Assalamu alaikum warahmatullahi wabarakatuh. Level of preventions. Primordial, primary, secondary, tertiary. Primordial preventions consist of actions and measures that inhibit the emergence of risk factors in the form of environmental, economic, social, and behavioral conditions and cultural patterns of living. It is the preventions of the emergence or development of risks in countries or population group in which they have not yet appeared. For example, many adult health problems, obesity and hypertension have their early origin in childhood because this is the time when lifestyle are formed, for example, smoking, eating habits and physical exercise. अच्छा, ये दो चीज़ें जो है जो कि ओबिसिटी है और हाइपरटेंशन है, इन दोनों के जो रिस्क फैक्टर्स रहते हैं वो चाइल्डहुड के अंदर ही ज़ाहिर होना शुरू हो जाते हैं और यही आगे जाकर जो है हाइपरटेंशन और ओबिसिटी का सबब बनते हैं। तो इन जो है वो डाइट हैबिट्स को, जैसे कि बच्चा स्मोकिंग करता है, फिजिकल एक्टिविटी नहीं करता, ईटिंग हैबिट जो है वो ख़राब है, तो इसको जो है ना आपने ठीक करना है। In primordial preventions, efforts are directed towards discouraging children from adopting harmful lifestyle. The main intervention in primordial prevention is through individual and mass education. Primary preventions can be defined as the action taken prior to the onset of disease which remove the possibility that the disease will ever occur. It signifies interventions in the pre-pathogenesis phase of a disease or health problem. Primary preventions may be accomplished by measures of health promotion and specific protections. Primary preventions, it includes the concept of positive health, a concept that encourages achievement and maintenance of an acceptable level of health that will enable every individual to lead a socially and economically productive life. Primary preventions may be accomplished by measures designed to promote general health and well-being and quality of life of people or by specific protective measures. Primary prevention achieved by health promotion and specific protections. Health promotions, health educations, environmental modification, nutrition interventions, lifestyle and behavioral changes. Specific protections, immunization and seroprophylaxis, chemoprophylaxis, use of specific nutrient or supplementations, protections against occupational hazards, safety of drugs and foods, control of environmental factors, for example, air pollution. Health promotions. Health promotion is the process of enabling people to increase control over the determinants of health and thereby improve their health. Approaches for primary prevention. WHO has recommended the following approaches for the primary prevention of chronic diseases where the risk factors are established: a population mass strategy, high risk strategy. Population mass strategy. Population strategy is directed at the whole population irrespective of individual risk levels. For example, studies have shown that even a small reduction in the average blood pressure or serum cholesterol of the population would produce a large reduction in the incidence of cardiovascular disease. The population approach is directed towards socioeconomic, behavioral, and lifestyle changes. The high-risk strategy aims to bring preventive care to individuals at special risk. This requires detections of individuals at high risk by the optimum use of clinical methods. Secondary prevention. It is defined as actions which halts the progress of a disease at its incipient stage and prevents complication. The specific interventions are early diagnosis, screening test and case finding programs and adequate treatment. Secondary prevention attempts to arrest the disease process, restore health, by seeking out unrecognized disease and treating it before irreversible pathological changes take place and reverse communicability of infectious diseases. It thus protects others from in the community from acquiring the infection and thus provide advanced secondary in prevention for the infected ones and primary prevention for their potential contacts. Secondary protections prevention attempts to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible pathological changes take place and reverse communicability of infectious disease. It thus, it thus protects others from in the community from acquiring the infections and thus provide advanced secondary protection for the infected ones and primary prevention of their potential in contacts. Early diagnosis and treatment. WHO Expert Committee in 1973 defined early detection of health disorders as the detections of disturbances of homeostasis and compensatory mechanism, while biochemical, morphological, and functional changes are still reversible. The earlier the disease is diagnosed and treated, the better it is for prognosis of the case and in the prevention of occurrence of other secondary cases. Tertiary prevention. It is used when the disease process has advanced beyond its early stage. It is defined as all the measures available to reduce or limit impairment and disability and to promote the patient's adjustment to irremediable conditions. Intervention that should be accomplished in the stage of tertiary prevention or disability limitations and rehabilitation. Disability limitations. Disease, impairment, disability, handicap. Impairment. Impairment is any loss or abnormality of psychological, physiological, or structure or function. Impairment is any loss or abnormality of psychological, physical. Impairment is any loss or abnormality of psychological, physiological, anatomical structure or functions. Disability is any restrictions or lack of ability to perform an activity in the manner or within the range considered normal for the human beings. Handicap. Handicap is termed as a disadvantage for a given individual resulting from an impairment or disability that limits or prevents the fulfillment of a role in the community that is normal depending on age, sex, and social and cultural factors for that individual. Rehabilitation. Rehabilitation is the combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible level of functional ability. Rehabilitation. Medical rehabilitation, vocational rehabilitation, social rehabilitation, psychological rehabilitations. Strategy for prevention. Modify existing intervention program, evaluate identify populations at high risk disease depends on demographic, family history, host factors. Access exposure, conduct research on mechanism including the study of genetic counseling. Apply population based intervention program, evaluate intervention programs, modify existing interventions program. Thank you very much. Allah Hafiz.